Hello, welcome to the NAHSE Houston chapter's interview with Kyandra Fox of Susan G. Komen. Today we're going to talk about the Patient Navigator training program. My name is Keira Miller and I'm the President-Elect of the NAHSE Houston chapter. Kyandra is a manager of patient navigation, education, and outreach at Susan G. Komen, where she oversees the Patient Navigation Training Program. It has a twofold approach: workforce development and providing navigators with the tools to help eliminate barriers to care for patients. Kyandra, today, thank you for joining us, first of all. Let's start with, what is Susan G. Komen and what is breast cancer?
Yeah, very great question. So Susan G. Komen is the world's leading breast cancer organization with a vision of a world without breast cancer. Komen is the only organization with a 360-degree approach to breast cancer. So that approach includes working to save lives through research, direct patient support, and public policy and advocacy. And breast cancer occurs when cells in the breast divide and grow without their normal control. In 2021, over 280,000 women will be diagnosed with breast cancer in the United States. Men can also get breast cancer, and over 2,600 men will be diagnosed with breast cancer in the United States this year. Over 40,000 people will lose their lives this year to the disease.
Okay, thank you for sharing that very important information. Can you discuss the breast cancer gap in the health disparities for Black women?
Absolutely. Black women experience higher rates of death from breast cancer due to a combination of factors. Some factors include barriers to early diagnosis, the aggressive nature of certain breast cancers that are more prevalent in Black women, genetics, lack of high quality care, discrimination, and systematic racism.
With all that being said, what are some of the statistics around the breast cancer outcomes for Black women?
So I'll highlight a few statistics. One is Black women are about 40% more likely to die of breast cancer than white women. Another is Black women have a lower 5-year breast cancer survival rate compared to white women. And also, Black women are more likely to be diagnosed with breast cancer at a younger age, at later stages, and with more aggressive types of breast cancer than white women.
Okay, so at Susan G. Komen, what is your organization doing to address these health disparities?
Yeah, what a great question. So, achieving health equity is a priority for Komen, and our health equity work can be found in each area of our mission work, including research, public policy, and community health. We execute this work in 5 key ways. We empower the public, and we do this through education. We connect people, patients, to timely, high quality care through our patient care center. We develop the next generation of diverse healthcare leaders. One of the ways we do that is through the Patient Navigation Training Program, which we'll get into a little bit later. We spark discovery through representative research and clinical trials, and we give a voice to all breast cancer patients in policy development.
Okay, thank you for that. So tell us more about one of the initiatives. What is the Stand for Her initiative and what are its goals?
So one of our flagship health equity programs is our program focused on Black patients in the 10 United States metropolitan areas across the country that have the worst breast cancer disparities. So this initiative is called the Stand for Her initiative, and the HER stands for a health equity revolution. The goal of this initiative is to reduce breast cancer disparities in the Black community by 25%, starting in these metropolitan areas. And so Komen conducted a landscape analysis of these 10 MTAs targeted by the Stand for Her initiative. And we did this to describe systematic barriers that may contribute to breast cancer inequities, and also to understand individual, community, and health system factors contributing to breast cancer inequities. Among all the things we've learned from this landscape analysis, we confirm that access to care is playing a big part in the disparities being experienced in these cities and beyond. As a result, we are now working in each metro area to provide access to screening and diagnostic services, support through our Komen Breast Cancer Care Helpline, financial assistance for patients currently in treatment, and through patient navigation.
Thank you for that. So of course you mentioned the 10 metropolitan areas. So which cities are the focus areas for this program?
Yes, thanks for asking that. So the 10 metropolitan areas of this initiative include Atlanta, Georgia, St. Louis, Missouri, Washington, D.C., Houston, Texas, Dallas, Texas, Memphis, Tennessee, Tidewater, Virginia, Los Angeles, California, Philadelphia, Pennsylvania, and Chicago, Illinois.
So being that you mentioned Houston, Texas as one of those metropolitan areas, can you discuss the key findings for breast cancer in Houston in
Yeah,
Houston? How does it compare to the other cities?
Yeah, absolutely. Great question. So the landscape analysis that I mentioned earlier, it's actually titled A Roadmap to Save the Lives of Black Women in America. That analysis was done in each of the 10 metropolitan cities. So in Houston, it found that in 4 out of the 5 Houston area counties, Black women are more likely than white women to die from breast cancer. Among other things, this can be attributed to economic vulnerability, a large percentage of uninsured and underinsured, and a lower quality of healthcare due to both structural and personal racism. A few other key findings from Komen's research in Houston include the fact that Black women are more likely to be diagnosed with late stage breast cancer than white women in 3 out of the 5 counties. The main barriers cited are high cost to breast cancer diagnosis and treatment and poor and limited insurance. Black women often delay screening due to restrictive work policies and fear of losing their jobs. So with all that being said, I highly encourage everyone to read the full report of Komen's findings through the landscape analysis, not only in Houston, but also the 9 other cities. And that can be found at komen.org on the health equity page.
Okay, thank you for all that great information. So we mentioned the Patient Navigator training program. So can you describe the purpose of the program and the need is trying to serve?
Yes, absolutely. So Susan G. Komen, Stand for Her Patient Navigation Training Program, gives training strategies to help Black patients navigate the healthcare system. So Komen believes that one of the most transformational ways to create systematic change and also close gaps is to invest in improving healthcare delivery to Black women. So this goes back to the twofold approach that you mentioned earlier. So the approach is really to empower the next generation of healthcare navigators while also giving them the tools and the resources they need to better serve and navigate Black patients through their breast cancer and cancer care journeys. The Stand for Her program really empowers Black individuals who are traditionally underrepresented in the healthcare careers while also giving them the tools I mentioned earlier.
Okay. So for those who may be unfamiliar with it, what is patient navigation?
So patient navigation really is a tool that addresses health disparities, and it does that by eliminating an individual's barriers to quality care and also helping patients effectively navigate a fragmented healthcare system. Patient navigators in cancer care are trained to connect patients to resources, and this includes medical services, clinical trials, genetic testing and counseling, palliative care, financial assistance, insurance, transportation, support groups, and more.
Okay, so you mentioned that with the patient navigators, they're trained to connect patients to different resources. So how is this program beneficial?
Yeah. So this training is really more than just a training. The program is really more than just a training. So Komen aims to build a supportive, interactive learning community to help trainees develop professional skills, peer network, and emotional support that they need to best serve patients and meet the needs of Black women experiencing disparities in breast cancer outcomes. One thing we say when a trainee enrolls in the program is once a part of the Komen family, always a part of the Komen family. We truly mean that because we're always there to give tools, resources, and support to uplift these navigators and uplift the patients that they serve.
Okay, so if someone's interested in this program, what can they expect?
So the core curriculum of the patient navigation training program is adapted from George Washington University's program in partnership with them. And so those cover the core competencies, those courses rather cover the core competencies and foundations of patient navigation. The training also includes more targeted and specific resources related to navigating Black patients. This includes a first of its kind class on navigating Black patients through racism and bias in healthcare. So this course goes over the historical context of racism and goes all the way back to the times of slavery and how that manifests itself within our system today. It also provides instruction on how a navigator can help their patient facing disparities and barriers to care. So the course takes approximately 10 hours to complete with additional optional electives and more in-depth breast cancer specific curriculum that's available for those seeking to add more breast specific expertise to their navigation experience. The course is online through our portal and it spans 10 weeks. So that's about an hour or so a week. Through the platform, though the platform of the program is online, trainees have the option to participate in weekly office hours, and that serves as an avenue for them to get questions answered, network with each other, and engage with peers. And this is really crucial, and it's part of the Komen family aspect of it as well. So they'll begin to build their own network of individuals that might also be in their area should they need additional resources or support. Graduates receive a certification of completion, a virtual graduation, and ongoing networking and learning opportunities.
Oh, wow, this sounds like an amazing opportunity, just so much to learn. So who is a potential candidate for the Patient Navigator program?
Yeah. So we welcome everyone, but our target group is Black individuals who are interested in becoming or are already working in a patient-facing role, such as a community health worker, care coordinator, case manager, social worker, patient navigator, nurse navigator, medical assistant, or any other patient-facing role within one of the 10 cities of the Stand for Her initiative. So we do welcome everyone. But if you fall under one of those groups and you're within the 10 metropolitan cities, there is an incentive for completing the program, and that's in form of an Amazon gift card.
Okay, that's a great reward as well. So when does the program take place, and do you offer any virtual opportunities?
Yeah, so this whole program is virtual. And although it's virtual, we do encourage all trainees to engage with each other. And this is done through forums, virtual office hours, panel discussions, and more. The program starts on a continuous basis. So once an individual registers for the program, they'll get a follow-up email within a week on when their start date will be.
Okay, so Why is it important for health service professionals to participate in this program?
So it's critical, right? Because the program really highlights the core competencies of a navigator through a health equity lens. This means that the information is tailored towards navigating diverse populations, so the barriers and resources cited throughout the program are extremely relevant and would be helpful for anyone. And it also serves as a learning opportunity so that our navigators can go back into their communities and pour this knowledge into patients that they might be serving.
Okay, thank you for that. So, how do potential participants sign up for this amazing program?
As we'd love for everyone to sign up. So potential trainees can sign up by contacting me at navigationnation@komen.org. And that's navigationnation@komen.org. Or by registering through a link, which I believe you all will post in the video information.
Okay, so I just want to thank you so much for joining the NAHSE Houston chapter today. We have Kyandra Fox. So she is the manager of patient navigation, education, and outreach at Susan G. Komen. And I encourage you that if you're in any of the 10 metropolitan areas to sign up for this great program. If you're in Atlanta, St. Louis, Washington, D.C., here in Houston, Dallas, Memphis, Tidewater, Virginia, Los Angeles, Philadelphia, or Chicago to find out more about this program and definitely sign up for it. So Kyandra, we definitely want to thank you so much for your time, and we look forward to talking to you in the future.
Yes, thank you for your time. It's been a joy. Talk to you later.
All right, thank you. It's been a pleasure. Have a good day.
Yeah.
All right, bye-bye.